back to the GBNews People's Poll, and Rishi Sunak has admitted that he's used private healthcare in the past. It used to be, didn't it used to be like people admitting that they'd done drugs in the past? Now it's whether or not they've used private healthcare. Anyway, it's criticism from those who say elected officials should be using the National Health Service. So we put it to you, the people, to see what you think. And 53% of you said that it was totally or slightly acceptable for the Prime Minister to use private healthcare. Just 27% of you said it was unacceptable. Well, with me now is Stephen Dorrell, former Secretary of State for Health, to discuss these results. Stephen, thank you very much. Do you have private healthcare?
Good afternoon, Patrick. I'm sorry?
Do you have private healthcare?
I didn't hear the question.
Oh, one more time.
The answer is I'm not insured, but I have used private healthcare. I think the Prime Minister should have been very straightforward that he has used private healthcare. Seems to me a straightforward choice for a free citizen in a free country.
Yes, exactly. Now, why on earth do you think that, was it 27% of people think it's unacceptable for a Prime Minister to go private?
Well, if I may say so, Patrick, I don't doubt what your view is on this, but you did, in introducing this piece, use the word admit. Now, I don't have to admit that you have used private healthcare or that my children were privately educated. That's not a matter of admission. It's a matter of straightforward choice. As a public official, when I was an elected public official, I'm now very actively concerned as a Liberal Democrat in the development of public policy. I'm strongly in favour of high-quality education services, high-quality health services. But what kind of a free society is it where a free citizen can use their own money for foreign holidays or Mars bars, but can't use it for education services or health services? It's nonsense. Okay. Of course, people should be free to use these services, but it shouldn't be used to undermine their commitment to the delivery of high-quality public services.
Well, I think it's a complete red herring. You're right about using the word admit, which is why I've made a bit of a joke, because they used to have to say that about drug use, didn't they, back in the day? Do you admit to have ever had a little puff on a cannabis joint or anything like that? And now it's do you admit that when you got your hernia done, you used Bupa? I mean, it's amazing, isn't it, the way that we've fallen as a society into that. But
it's just the wrong use of words.
Yeah, you're correct. And thank you for pulling me up on it. There you go. I stand corrected. Anyway, when it comes to the debate, let me play devil's advocate here. Is there a school of thought that says if you are an elected representative of the people, you should live in the worst house on the street, send your kid to the worst comprehensive school in your area, only use the local hospital, only travel by public transport, so that you have a real grasp of what normal people have to go through on a daily basis?
Well, you asked the question, is there a school of thought that holds those views? I'm not sure I'd call it a school of thought. There may be people to whom that feels right. I'm not one of them. There are two arguments here. One is about the choice that individuals make in the use of their own money. And the second, equally important point, actually, is that I think in the public services, we should be aspiring to deliver the best we can with the resources available for the population of this country. Now, one of the things that quite often happens is that people look at new ideas being developed in private services, say, hang on a minute, they can have it, they pay for it. Why can't we have it on the National Health Service or in maintained schools and in other public services?